What's up, guys? Quinn Henoch here, Doctor of Physical Therapy of Clinical Athlete and Juggernaut Training Systems. We're here with Squat School number 3. We're talking about hip structure and how it relates to the squat. And so you hear a lot of times on the internet, videos, blogs, various things where everybody should strive for a certain squat position, as in there's this optimal position that should fit everyone, where everyone's in this cookie cutter approach where it's either toes forward or it's narrow, and that's what we should all strive for. And if you don't have that position, you have to do a bunch of drills and mobilities, drills and stretches and all these things to try to attain some type of gold standard. So what is more along the lines of truth and evidence is that everybody has to squat a little bit differently based on the structure of their hip, based on the limb lengths that they have, and various other anatomical differences. And that's what we're going to demonstrate here. So we've got two different athletes, Colin Burns, Courtney Batchelor, two snatch American record holders. They know how to squat, but what you're going to see is they both squat very differently. So Courtney, I want you to hit a couple air squats as you typically would. So attain whatever squat position you would. And so you can see Courtney prefers a toes out position, a little bit wider. And this is something that a lot of people would say maybe we would want to correct for some reason that putting your toes out would be injurious or unsafe or less optimal for performance. But really, if you look, what's happening here is her knees track right over the middle of her feet. Her joints are stacked, the hip, knees, and ankles just hinge naturally. You know, it's bend and straighten. But that is her position. That's what she prefers. That's where she feels strongest. That's where her hips feel the most open. Colin, now, as far as our guidelines and general rules of thumb, hips, knees, and ankles hinging naturally, the knees tracking generally over the middle of the foot, is the same. You know, he's meeting those guidelines, but you can see his position is much different. He's more narrow relative to his body height than Courtney. His toes are much straighter. Courtney, do me a favor and try to squat like Colin. Try to mimic that. Do that again. Yeah, it looks super awkward, right? How does that feel?
Terrible.
Go a little bit wider with your feet, but still go toes forward. Right there. Good? Yeah. Okay. Yeah. So would you say that it feels like to you that that stance is not optimal, even though that's kind of what we hear, you know, toes forward, go back to where you were just so people can have a visual and squat from there. Good. And then Colin, try to mimic Courtney's stance. So for you, it's going to be a little bit wider, toes way out, yeah. Drink your soup. Do that again. Now, what does that feel like to you?
It feels like I have no balance.
No balance, and so it feels weaker. Now, Colin, and so what we're going to do is show you guys why this is so, why people squat differently, and test some simple drills and visuals so you guys can see as far as hip structure dictating these things. Now, Colin is one of those guys where I think he could squat from a mobility standpoint in any position he wanted. For him, it's going to be about what feels the strongest. For Courtney, it's going to be respecting anatomy a little bit more. So Courtney, lay on your back here on the table. And as coaches, assessing joints is not necessarily something that you have to do or maybe even want to do. We can kind of skip to the drills that we'll do following this. And for you guys, for any of the clinicians in the room or on the internet watching this, this will be familiar as just general hip range of motion testing. And so I'm going to take Courtney's hip, and from a straight mobility standpoint, passive range of motion is really where it's at, right? Can the joints attain the range of motion that we're trying to load? And so when I take Courtney into just straight hip flexion, where the foot is in line with the knee, I'm pushing the knee straight, maybe towards kind of the inside of her left shoulder here, I hit kind of a block, right? And it's just below parallel. What does that feel like to you? It's just a little uncomfortable, right? And so likely she's not going to squat in this position if she feels that. Now I'll kind of move the hip joint around. I'm not pressing terribly hard, but all of a sudden I kind of feel like it falls into a cleft. It feels much more open when she's wider. So does that feel more comfortable to you out here? And if you guys remember how she squatted, this is very similar to the way that she squats, so it makes perfect sense. This would mimic a more narrow stance. It jams up a little bit. I can feel that. She can feel it if we come out a little wider. Then she has more space. And that has everything to do I'll back up, that has very little to do with her lack of mobility or something wrong with her hips, and very much more to do with her anatomy and what's individual to her. And we can take that assessment a little further and look at rotation. And so if I rotate the hip this way, this would be external hip rotation. The foot is going in, but the hip is rotating out. And if this is 0 degrees, she's pretty darn close to about 90, I would say maybe 80 degrees of external rotation, which is plenty for a squat. It's a surplus of external rotation. When we go into internal rotation, she's a little bit more limited. I hit a bony block, and that's just the way that she's structured. So if this is 0, maybe we're getting 10, 15 degrees there. What does that feel like? Little janky? Yeah, so and it makes perfect sense. She prefers external rotation, which is her toes out position, and she prefers to be a little wider because that's where her hip socket has the most space. Now if we take Colin, get out of here. Go play in traffic. If you remember, his squat was much more toes forward. It was a little bit more narrow relative to his body. So if I assess the hip this way, again, same way, foot in line with knee, knee tracking pretty close or similar to a narrow squat. It's much more free in that position. This would be like his feet, 6 inches apart in the squat. And so it's not necessarily mimicking his exact stance, but just in general, I'm not feeling much of a block when I go there. And that's likely why he can squat a little bit more narrow. And if I, again, scour the hip joint a little bit, and there's a groove that I hit about right there that's much more narrow than Courtney's, whereas I took Courtney's knee way out to the side to get her greatest depth. And that actually takes Colin into a little bit more shallow of a position. His hip socket, or his hip actually comes back to me into extension. And so the deepest point of his hip is about right there. And that happens to be where he prefers to squat, shockingly enough. And if we look at rotation, so this is Colin's external hip rotation. So if this is 0 and this would be 90 degrees, he is maybe at 45, which is still plenty for a squat. I mean, who squats with their knees that far outside of their foot? So he's got enough external rotation, but you can see the difference between him and Courtney. And if we look at internal rotation of the hip, much more capacity than with Courtney's structure. You can see if this is hip internal rotation at 0, way out here to maybe 35, 40 degrees. Now, obviously, he's not going to squat like that, but what that allows him to do is squat a little bit more narrow, almost like he's sitting in between his feet with his toes straight. And there's a lot of variables that have to do with that. The angle of the femoral neck, where the hip sockets are oriented relative to the pelvis, the depth of the hip socket, none of that really matters. I don't have x-ray vision, I can't see that stuff. And so a quick little assessment will give me an idea. And so we can take that and use the next couple drills for athletes to figure out, and coaches to help their athletes figure out what bottom position is most optimal for them. So let's go into quadruped. So we took the table test and kind of get an idea, and if we think about the sequence of things, you would look at somebody's squat. A squat assessment can be very simple. You just have them squat, get an idea of the positions that they prefer, move their hips around to kind of confirm what you're seeing, and then you can mess around a little bit in positions like quadruped, in standing with the counterbalance, which we'll go to, for them to optimize their bottom position for the individual. And so we use this drill a lot just to teach the athlete where their hips feel the most comfortable. And so in this quadruped position, you can think of this as quadruped squatting, because it is that triple flexion phenomenon if he rocks back. So go back to neutral here. And we'll set the hips above the knees and the shoulders above the hands just to start. And my cue will be, put your knees and your feet, mimic your squat stance. Put them where you would think that it would feel most comfortable when you're on your feet. And what I'll have them do is simply rock back. Leverage the ground a little bit with the arms and push back. And if you can see, Colin again prefers for his feet to be in line with his knees, if not slightly outside. And that's that internal rotation that he has the capacity to do. And it's also that hip socket that's more comfortable in that straight plane of flexion. Now go, Colin, come out a little bit. Put your knees a little wider, just slightly, and then feet a little bit more narrow. And this mimics or biases a little bit more hip external rotation. And so it's more of what was consistent with Courtney squat. What does that feel like to you?
Feels jammed up, like I can't go as far.
Feels a little jammed up, like he can't go as far. Okay, so for him, biasing external rotation feels a little bit more crowded in the hip, which makes perfect sense because when we tested the hips, he had almost equal internal rotation versus external rotation. His external rotation was a little bit more crowded. So it makes perfect sense. And again, this is just for the athlete to feel what position works best for them. Go back to where your feet were. And what we can do from this point is go down, because if you think about this, if it was mimicking a squat, if I flipped Colin onto his feet, his torso would be completely vertical. He'd probably fall on his butt. So what we can do to mimic the torso angle of the squat is come back up and then go down to your forearms. Now we've got that forward inclination of the torso that truly mimics a squat. And he can drive his elbows into the floor and kind of leverage his hips back. We're trying to stay as flat as possible. And he can take some deep breaths here, breathe in, exhale really hard and try to push back into that position. And this is mobility, but it's kind of an athlete getting used to, especially a new athlete, getting used to being in the bottom of a squat in a more stable position, which is quadruped versus standing. Come back up here. If you are an athlete or have an athlete who tends to feel pinching in the front of the hips, or they get some type of rounding in the lower back of the bottom of the squat, this is a drill that can really teach them how to grease that groove a little bit and groove that squatting pattern. Well, what you can do, go back up to your hands, and let's say, and Colin's got hip range of motion for days. He can pretty much pick whatever position that he prefers to squat. That's whatever feels the strongest for him. He's got options. But if you've got somebody who feels some crowding in the front of their hips when they squat, what you can do is get in this position, rock back, and let's say Colin says to me, oh yeah, I feel a little pinching in my, in my right hip or my left hip when I hit this point. And I ask, is that what you feel when you squat? And if he says yes, it's like, okay, this is consistent with what we need to intervene on. What we can do is actually tilt the pelvis back, okay? So we can go into this pooping dog position momentarily and then rock back a little further. And what you're gonna find is that posterior pelvic tilt actually takes away some of that pinch because it decreases the impingement in the front. It just creates a little bit more space in the front of the hip joint. Now that he's a little bit deeper into his squat, now we can reverse the curve and work on getting that anterior pelvic tilt and that flatter back like what we would want when we load. So think about this as kind of going around the crowdedness and then trying to reposition once you're in the bottom of the squat, as opposed to coming up, arching really hard and then trying to jam your way back and then recreating your hip symptoms. You can play around with foot position or knee position or pelvic tilt to clear some space in your hip and just spend a few minutes there rocking back and forth, holding, pushing your hands into the ground, creating tension in your abs and just getting used to that position. So we dialed in our quadruped position for Colin, what feels most comfortable for him. Now we can add some load, and I like this drill as a way to build the squatting position from the bottom up as opposed to the top down, which, for example, somebody in standing who has trouble getting to the bottom of the squat, they feel uncomfortable, or they feel like things are just not stacked or optimal. We can work this quadruped position and get them into their bottom squat position without them having to try to find it from the top. It's a nice regression and a nice teaching tool for a new lifter. So what Colin's going to do is he's going to rock his hips back, trying to stay as flat as possible, and he's going to push his hands back and start to push himself back onto his feet. Now you'll get some rounding here and it's totally fine, we're unloaded here, but he's trying to reestablish that arch, and oh, look what's waiting for him is a nice counterbalance there between his feet that he can hold and just hang out. Breathe in, exhale really hard, try to get tall through your upper back. This is a great position to work on that T-spine extension that, by the way, is not a huge excursion of movement. It is there, but it's more about maintaining that position. And once you're already in the bottom of a squat, it becomes very easy to extend and get that motion from where we want it, which is the upper back. And then he can put the bell down. We don't even have to stand up in this position. We can just transition back and forth. So he can walk back to quadruped, and then drive back. Use the floor as leverage, pushing into his hips. And he has a nice counterbalance there to meet him. And he can hold for 4 or 5 breaths. Breathe in, create tension through the upper back, create tension through the abs, get tall through the top of the head. and back down, and transition, and relax. So we can take the hip assessment, and we go back to summarize the sequence here. I took these, I'm pretending these are new athletes, I know nothing about them. They showed me their air squat, they showed me the patterns and the positions that they prefer, and then I did a little range of motion testing just to kind of confirm what I'm seeing. And then we went to the quadruped position, started to build positions back up and got them comfortable and kind of figured out where their hips go. The idea is taking the quadruped drill into standing, and so we recreate those positions. And I like a counterbalance. Now these two athletes are obviously top level weightlifters, and we could just go out there in the gym and put a barbell on their back and play around with position that way. But if you've got a new lifter, somebody who's kind of new to this stuff, or they're coming back off of injury, a counterbalance can be very useful. So we're going to go back to playing around with positions. What the counterbalance allows us to do is mess around a little bit and experiment without having to worry about falling on your butt. And again, for a new lifter, it's pretty useful. So hold that guy in front of you, maybe 6 to 8 inches. And then let's turn that way and go, let's mimic Colin again. So this is where we can experiment. And I do this a lot. We have just take people through different positions. So this is more narrow, slightly more toes forward. What's your best squat, Courtney?
55.
155, that's kilos. Yeah. As a 50, and you look real, it doesn't look comfortable. It looks very weak, it is like wiggly. Go as deep as you can in this narrow toes forward position. Good. So that feels a little crowded, right? Come back up. Go where you prefer, and then squat. So much better. So once you find, and you can play around with positions as long as you want. You can mess around with different things. You've got foot width that you can experiment with, the degree of toe angle, and also pelvic tilt. You can arch a little harder, you can go a little bit more neutral, but you have all these variables to mess around with, just like we did in quadruped. Go back to your normal squat stance, and then what we can do, once you find that comfortable position, you can have the athlete do tempos or pauses. So I want you to descend like 5-second descent, exaggerate it. Good, slow, 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 and then pause there. Hold, 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 and then sink down a little lower. And once they're down there, you can have them slowly lower the bell down to the ground. Keep your hands on it. Now take one finger off at a time and try to hold this position. So breathe in through your nose, exhale really hard to try to get some ab tension. Take one finger off at a time and hold. Good. Nice. And come back up. So you'll find that some athletes who can't hold that bottom position with just their air squat, give them a counterbalance, get them down there, and then they can transition to learning how to create that tension. Colin, let's roll. We'll do the same thing here. Let's go. Let's do a Courtney squat. And again, Colin, is more of a demonstration of somebody who he has the mobility to squat any way that he wants. It's going to be where he feels the strongest. So drive out of the hole. Go to where you feel like is most optimal for you. And same thing. Slower, slow, slow, slow. Does that feel more natural, that position? Okay, so we found his position that's a little bit better for him. Transition that bell to the ground very slowly. While you're doing this, keep in mind that you can have somebody's heels lifted a little bit. They can be in weightlifting shoes. That can add to the counterbalance. Just depends on the level of the lifter. Breathe in through your nose, exhale really hard. Get tall through your upper back and try to hold that position while you let go of the bell. And it's literally one fingertip at a time. And this can really help to teach them that bottom position. And come back up. So that is this episode of Squat School. I'm Dr. Quinn Henoch of Clinical Athlete and Juggernaut Training Systems. I hope you learned something. The summary is not everybody has to squat the same. Mess around, experiment with different positions, and don't deem a position or a movement good, bad, right, or wrong without addressing and acknowledging some of these things. And if you're looking for a healthcare provider who understands athletes, check the directory at clinicalathlete.com. Thanks, guys.